We will begin tonight with the latest on the COVID-19 situation. But speaking of the numbers, it has been a week that we've been seeing thousands and thousands of new cases every single day. And today, Thailand recorded 1,443 new infections as well as 4 new deaths as well. So 4 more deaths brings the national death toll to 108. According to the CCSA spokesperson, Dr. Tawisin Wisnuyotin announced today that 1,443 new infections have been recorded, and that brings the cumulative total in the newest outbreak since the beginning of April to 16,332, while the cumulative total since early last year is now 45,185. And among the new infections today, 1,328 of them are under observation and treatment, and the other 113 cases were from proactive screening. And if we now look at the COVID-19 vaccination program in Thailand, so far over 600,000 people have been vaccinated already. However, the number of people who received the second dose is much smaller if you look at the proportions between those who received the first dose and those who received the second dose. And most importantly, those who have been inoculated are mostly medical personnel and those living in higher risk areas. And as you can see, the percentage here is a lot higher than other groups, where other groups will be seeing a very smaller percentage here. And besides the vaccination program, there has been concerns about the management of hospital beds for COVID-19 patients as well. So Dr. Tawisin explained that they are allocated in accordance with the severity of the patient's illness, which are split into levels designated by color. So there are 3 groups. So the green group is for asymptomatic cases or those with mild symptoms such as fever, cough, rashes, and red eyes. So this group will be sent to field hospitals or hospitals. So hospitals are hotels that were turned into hospitals, and they will be sent there for treatment. As for the yellow group is for non-severe cases. That includes those who experience fatigue and rapid breathing and people at high risk who have underlying diseases such as chronic kidney disease, stroke, uncontrollable diabetes, obesity, lung diseases, and as well as heart diseases as well. And for the red group is for patients suffering fatigue while walking, having breathing difficulties, and those with severe lung inflammations or pneumonia. So both the yellow and red group patients will be housed in general hospitals. And Dr. Tawisin said that around 600 patients are awaiting hospital admission, of which about 100 are in the yellow and the red groups as well. So the 100 people are expected to be admitted today. And there has been a comment from Dr. Opat Patsaran, who's the head of the Center for Clinical Emerging Infectious Diseases at Chulalongkorn University, who posted on Facebook today that more severe COVID-19 cases are expected to be in ICUs or intensive care units this week, as well as a surge in patients who have lung infections as well, mostly among the young people or otherwise healthy patients here. And he also said that the UK variant of the virus, which is very dominant in this wave of COVID-19, is much more contagious, as we previously reported, and the symptoms are much more severe than the other variants as well.